My name is Suzanne Farley, and I work for WELLSPRING here in Bangor, and my position is Executive Director. Our mission really is to provide treatment for folks experiencing substance use disorder and or co-occurring mental health concerns in addition to their substance use treatment. So far, we've been very lucky. We haven't had any outbreaks in our congregate care settings, and we haven't lost any staff. The funds that we got from United Way we were able to utilize in terms of really ensuring that all of our clients that wanted to participate moving forward had access to the technology that they needed. So some people needed phones, some people needed headphones, some people needed just help with learning how to access the computer. We needed to have equipment in the agency as well. We needed cameras, we needed headsets, we needed laptops. So the money that United Way donated went towards helping us get those technological needs in place so we could continue to deliver our outpatient counseling services to more than 400 clients. Partnering with United Way was like having a real good friend down the street that you could call on when things were really rocky. And knowing that I could pick up the phone and call Jesse or Shira and just say, hey, we need some help, and trusting that they would do what they could through United Way in the community to support our agency that's been providing services since 1965. I mean, it's been a long partnership, it's a solid partnership, and it's one that I'm really proud to have.
My name is Bruce Campbell. I'm the Executive Director for the Bangor Area Recovery Network. Let me just start by saying our relationship with the United Way is in its first year. So we're trying to figure out how do we live as a United Way agency. This is kind of new for us. And one of the great things was that when this crisis hit, we were able to contact the United Way and get some additional support to be able to respond to the needs of the people that we serve. What it did was it provided us with the opportunity to purchase large quantities of face masks. We wanted everyone to come in and to have a face mask. And if they didn't have one, we would give them one. So we wanted to eliminate that barrier. We needed to buy gallons of hand sanitizer. As you can imagine, when you've got 280 people, those are the unique individuals, and a lot of people come more often than once. But more than anything else, we kind of got a really good idea of how United Way responds to the community in ways other than just its annual funding cycle.
I'm Caroline King. I'm the Executive Director of the American Red Cross of Northern and Eastern Maine. The mission of the Red Cross is to really prevent and alleviate human suffering. And that comes out in a variety of ways, from disaster relief services, responding to single-family house fires, large-scale disasters, to ensuring that the community has the blood and blood products that they need. The American Red Cross continues to provide direct service to individuals and families who have had disasters. Of course, COVID-19 has changed the way we do that service. Ensuring that our volunteers and our staff are safe has been one of our forefront priorities. We're not using small bottles of hand sanitizer. We're using it by the bucketful and by the gallon. One other example is we had to purchase new chairs for our blood donor center, chairs that could be hard surface, that could be washed and sanitized between donors. I have been so thrilled and so pleased to partner with the staff and volunteers at the United Way. Very early in the pandemic, I got a phone call from Shira asking how I was doing and what United Way could do for the Red Cross. And I still carry that with me every day. I am been so grateful and so fortunate to partner across the organization, across the United Way. The United Way has come in full force especially over the last year. New staff like Matt coming out to our home fire campaign rolling up his sleeves and really being a part of our work, to support the financial support that the United Way has offered us over the last month and a half. And we are grateful for those partnerships, really helping us to open up new partnerships with new organizations through some of the networking, all the Zoom calls and meetings and phone calls and check-ins. Those are so important, and we are so grateful for that partnership with a local organization like the United Way in Eastern Maine.